Good afternoon, everyone. We are here for the 2024 New Jersey Workability Updates being presented by Disability Rights New Jersey. I'm just admitting some last people who are in the waiting room, and then we're going to be getting started. This presentation will be shared. We're going to be putting it up on our website as well as the recording from the presentation after everything is completed. Welcome to the New Jersey Workability 2024 updates. This is being presented by Disability Rights New Jersey, and we are funded by the New Jersey Council for Developmental Disabilities. So a little bit of housekeeping. This presentation is being recorded, and it will be posted on our website after the presentation is completed, along with a PDF of the presentation itself, so that way you have access to it as a resource for reference. About Disability Rights New Jersey. We are the designated state protection and advocacy agency. Every state has an agency that is designated by the governor to represent individuals who have developmental disabilities and all individuals with disabilities throughout the state. So they're trying to investigate and monitor facilities where the individuals receive services or live to make sure they're not the subject of any abuse or neglect. One of our mission is that we advocate for and advance the human, civil, and legal rights of residents of New Jersey who have disabilities. We are funded today with the New Jersey Council for Developmental Disabilities. They are federally funded through the Developmental Disabilities Act as a self-governing organization charged with identifying the most pressing needs of people with developmental disabilities and their families in New Jersey, and to help advance public policy and systems change activities. So we have up here their vision and their commitment. Their mission is to champion and advance advocacy, systems change, and capacity building activities that honor the rich diversity of people with intellectual and/or developmental disabilities and their families in creating structural change with lasting impact that promotes self-determination, community integration, and inclusion. So we're here today to talk about workability. So we're going to start today with an introduction to workability, what it is and where it came from. Then we're going to go into how does you qualify for workability, what changed as a result of the 2022 legislation, and to why we're here, because there have been some very significant changes to this workability program. And they were broken into two different phases. There's phase one of the implementation that was put in 2023, and phase two that went into effect in February 2024. And then one of the big changes to the workability that we're going to go over is they've introduced a premium structure, which means if you make over a certain income, whether it's earned income, such as through wages, or unearned income through such as disability payments, workers' compensation, that can all be calculated to whether you'll have to pay a premium or not based off of certain income levels. And then lastly, we're going to end with how do you apply for workability? So there are several New Jersey Medicaid programs throughout the state, and they all fall under the umbrella of the New Jersey Family Care. If you receive Social Security benefits and supplemental security income, you receive Medicaid only. You also have the NJ Care, which is the age blind and disabled. You have the Affordable Care Act Medicaid, New Jersey Workability, the Managed Long-Term Services and Supports and DDD program, and then there's also a Medicare Savings Program. So we are one of the doors that you're able to get into the Medicaid family is through the workability. So what does that mean? It offers people with disabilities who are working and whose other income would otherwise make them ineligible for Medicaid the opportunity to receive Medicaid benefits. One of the things with the typical age blind disabled Medicaid, there's an income limit for most of the programs. I think the highest one right now is for an individual person, it's $2,400 a month, which is not a lot of income. So workability opens the door to allow people who are actively working in the community to have a way of having access to Medicaid to be able to get those services. And for some people, if you're on DDD, that is very, very important because you have to have Medicaid to be able to receive your DDD services. If you're able to have if you're able to get the Medicaid through having a higher wage, you're still able to keep those services while still getting your benefits. So the New Jersey WorkAbility program is a Medicaid buy-in for people who are employed or permanently disabled and authorized under the Federal Ticket to Work and Work Incentives Improvement Act of 1999. So that's a lot of legal mumbo jumbo to talk about. So let's break it down. How do you get eligibility for WorkAbility? You must be at least 16 years old and you must be a New Jersey resident. To qualify for these services, you must be employed either full or part-time and to be able to show proof of employment. Now, this can be a very low threshold. I believe the current threshold is if you've made $500 in the year, you're counted as employed, so you're able to receive benefits. So this doesn't have to mean that you're working for a company or you're working for another organization. You could be self-employed and still be eligible for WorkAbility. You just need to be able to show that you have proof of employment, whether that's you're filing a tax return, 1099, W-2s, something that you're able to point to and show, here's the income that I received from working. And then finally, you must have been determined as disabled by the Social Security Administration or a medical review team for the state at the Division of Medical Assistance and Health Services prior to age 65. So those are the general requirements for WorkAbility. And I'm going to explain a little bit more about what this disability determination is. Under Social Security Administration, a disability is defined as the inability of an individual to engage in substantial gainful activity by reason of any medically determinable physical or mental impairment, which can be expected to result in death, or which has lasted or can be expected to last for a continuous period of not less than 12 months. We also know that when you're looking for a disability determination, whether you're going for SSI or SSDI, they're also looking at what is that substantial gainful activity. Does your disability impact your ability to work or to earn wages? So the substantial gainful activity is an amount that with Social Security disability income, if you go over that amount, they can stop your benefits or start to wind you down so that way you're no longer receiving the SSDI. In contrast, we have the state designation, which is the medical review team at the New Jersey Division of Medical Assistance and Health Services, DMAS, which is the state Medicaid office. Their analysis is, are you an individual with a disability? That's it. It's no, it doesn't impact your ability to work. There's no, are you limited how much you're able to work? It's, do you have a medically documented disability? If the answer is yes, you will qualify under the medical review team. One caveat that we do want to mention, because this is something that not a lot of people may realize, if you've gone for the Social Security Administration determination, whether you've applied for SSI or SSDI benefits, and they come back with a finding that you do not have a disability, or if you've been on services and you've been receiving those benefits, and then you receive a notification that they found that you no longer meet the definition of having a disability, and that is after a disability review only, not after a finding that you're making too much money, but it has to be based off of your disability. You must wait 12 months before you're able to receive an assessment by the medical review team. If you're an individual who has received a notice from Social Security Administration saying that due to your work and your income, you've gone over that substantial gainful activity, and therefore you're being removed from SSDI, that does not trigger that 12-month waiting period. So in 2022, this is the reason that we're here today, there was legislation that got passed that expanded who was able to qualify for WorkAbility. And this really did substantially change the income requirements for WorkAbility and for the Medicaid programs. It removed barriers to employment and career advancement for individuals with disabilities. And as you'll see, as we're going through the slides, some of these changes were quite substantial and really had an impact on how much individuals are able to work and still keep their Medicaid benefits. So I know that was a big concern up until this bill, the law got fully enacted. Some people could work too much and then they lose all their benefits. They lose all of their services. And because they've lost their Medicaid, they've lost access to DDD. WorkAbility and the changes to the WorkAbility were a way of addressing that. So what are the changes that we're talking about? Before the 2022 changes, the maximum age for enrollment was 64 years old. So if you turned 65, you were automatically unenrolled from WorkAbility, even if you hadn't technically met the age to start getting Medicare. They didn't care what other forms or other programs you could qualify for with with Medicaid. It was just at 65 years old, you were removed from the WorkAbility books. Now there is no maximum age limit, and that was removed as of April 1st, 2023. Prior to 2022, when they were looking at the income eligibility, they were considering your spouse's income and assets. If you're married and you lived in the same home, it was the same calculation they use for supplemental security income. If you and your spouse both went over a certain threshold, you were ineligible. Now, as of April 1st, 2023, spousal income and assets are excluded from the calculation. They're just looking at how much you or the individual who is applying made for that year. Another change is your asset limit. As we all know, with a lot of the Medicaid programs and supplements and SSI programs, there's an asset limit that was enacted. And prior to 2022, that limit was $20,000 per person or $30,000 per couple, but it excluded things like your home, your car, a 401k that you yourself owned, and if you had any IRA. Apologize for just a second. Now, that limit has been changed and removed. So as of April 1st, 2023, there is no longer an asset limit to anybody who's looking to apply for WorkAbility. The biggest change that we saw with the WorkAbility bill is how they are handling earned income and unearned income. On the earned income, there was a limit before 2022 of 250% of the federal poverty level, which is about $6,190 per month per person. With the changes as of February 1st, 2024, they have removed that income limit for earned income. For unearned income, the prior requirement was that had to be under 100% of the federal poverty level, which is about $1,255 per month per person. Now, that affected a lot of people who receive benefits not from their own disability record, but who may have been getting it as a disabled adult child, either from a parent or from a spouse. If they made over $1,255 in that unearned income, didn't matter what their earned income or any other limit was, they were ineligible. As of February 1st, 2024, that limit has been removed. And so this opens the door to a lot more people who were previously excluded from WorkAbility to be able to get access to this program. And the continuation of Medicaid coverage before 2022, the coverage ended with job termination. As part of the legislation that was being enacted or that was put forward and accepted, there was continuous coverage for 1 year after job loss. We do raise that here, even though right now that status is a little bit in question, because the continued coverage continues to be implemented by state regulation and/or the administration, but it has not been approved by the Center for Medicaid Services and the federal government. So now we're going to walk through various things about what this means at the different levels. So phase 1 began to start to expand the eligibility. And phase 2 is where you see some of the more substantial changes, such as the removal of the earned income limit and the imposing of the premium structure. So in April 1st, 2023, New Jersey WorkAbility was now available to anybody over the age of 16. There was no longer that upper age limit cap of 65. So we had a lot of people who, in between 2022 and April 1st, 2023, that may have turned 65 and were automatically unenrolled, that we've been able to get back onto the WorkAbility registers because they're no longer age barred. And so that was one of the big things, because we all know our population is working later and later years. People are no longer retiring at 65. People are no longer retiring at 75. If you have somebody who's 80 years old and they're working, they can still qualify for WorkAbility because there's no maximum age limit. It also made the enrollment and more available to individuals by removing that asset limit and removing the spousal income and asset limit when they're as part of that calculation. So when you had the individual who was working, but their spouse may have made $70,000, $80,000 a year, and they would not have been eligible otherwise, with the April 1st, 2023 phase rollout, that removed that spousal income from the consideration, making more people eligible for services. Phase two is where we saw a much bigger expansion. And this was approved in April 2024 and rolled back to February 1st, 2024. There is no income limit for eligibility. Again, no income limit for eligibility. We'll go into a little bit about what counts as income and how it's calculated a little bit, but it did introduce a premium schedule based off of your total income as it relates to federal poverty limit. It will take into account both your earned and unearned income when you're calculating that amount. So the question then is, what counts as the earned and unearned income? Earned income is things like your wages. If you're working for yourself, if you're working for your own business, your self-employment earnings, workers' compensation benefits you receive, paid sick leave and disability plan benefits. Do you have short-term or long-term disability? That counts as earned income. So when we're talking about unearned income, we're talking things like alimony, Social Security benefits, specifically looking at disability benefits from a parent or spouse's record, unemployment benefits, interest payments, investment payments, and trust payments. And the way that they look at the two is the earned income is things that you've received in return for some work or some benefit that you've provided, where the unearned is money that comes to you not through the purposes of working. And so the question really becomes, how do they calculate and how do they really consider these different amounts when they're looking at their calculation to figure out what's your premium going to be? What is your earned income? I'm going to try and explain it as best that we're able to, while still admitting there's still some confusion about this because we haven't gotten clear guidance from the state on how they're going to be handling this. Income is not all treated equally. Earned income is typically counted at 50% of the value. So if somebody is making, say, $50,000 in earned wages, their countable income amount for the premium structure would be $25,000. And so that's just an automatic 50% of their income is not counted at the earned income level. Unearned income gets a little bit more tricky and a little bit less straightforward because some unearned income is disregarded or is excluded from calculation for the premium structure. Under the previous administration of the previous rules, this was things like if you had SSDI because of your own work record, that wasn't counted as part of the calculation. We have not gotten clarification from the state as to whether or not they're counting it for your unearned income currently. All we can get from them, and we'll go through what the official stance of the government is that it's unclear as to how the unearned income is going to be held. I have a question. Okay, somebody says they got the confirmation from a director of Medicaid in their county that your own SSDI benefit is not counted. Okay, Sharon, thank you very much for that confirmation, because that's the way it was under the previous rules for Social Security for workability. And so if they're not counting that with your own SSDI benefit, then that does not count towards that unearned income. So you're not going to need to include that into your calculation when trying to figure out what your structure, your earned and unearned structure is going to be for that premium price. Okay, they only count the parent benefit, and that's where I was talking about that disabled adult child, or a DAC benefit, you'll hear people calling it, where they're receiving services they're receiving SSDI payments based off of the disability or based off of the work record of a parent or a spouse. So the official position of the state is portions of both earned and unearned income are not counted. Because everyone's situation is different, the only way to really know for sure where you're going to fall in the premium chart is to apply for the services. So what does it mean? Once you fill out the application, the county welfare agency will review your income with you, both your earned and unearned, to determine what premium, if any, you would need to contribute. Is there a calculation worksheet we can use to calculate this? Unfortunately, Mary, right now we do not have that information because this is the only information that's really readily available. And that's just this little statement that it says both portions may be earned, both earned and unearned income may or may not be counted like and fully counted. But the only way to really know for sure is to apply. Nancy asks, should countable earnings after all earned income disregards be used to determine earned income? I don't believe that the IRWIs actually go towards the workability calculation. That's more for the SGA, but that's something that Nancy, I would need to do a little bit more research into, because right now with the workability, there is nothing that we've been able to find that goes towards the impairment related work expenses. So from what our calculation, what we've heard from DMOS is they're using gross payment or the full amount that you receive. They're not looking at what the net is after all disability related expenses are being deducted. So what exactly is this premium structure that we're talking about? And I'm about to put a lot of numbers up on this page, and it's probably going to be a little bit confusing, but I'll try to walk through it as best we can. So this is the current premium structure, and everything is based off of how much you're earning against federal poverty limit. So if you have somebody who is making under 250% of the federal poverty limit, which is somebody who with their earned income of $76,332 or an equivalent of the earned and unearned income of up to $37,650, they will have no premium amount that they will need to pay into their Medicaid per month. And then it starts to go up from there in intervals of by another 100%. So if somebody has a countable annual income of either earned and unearned, I'll get to your question in just a second, Nancy. Just earned and unearned between $37,650 and $52,710, their monthly premium amount is $175. And it continues up to where you see somebody is making more than 750% of federal poverty limit, which if you're just talking about an earned income is $226,932, or a countable annual income between earned and unearned of at least $112,950 per month, then your monthly premium is approximately $1,050. Now, this comes out to just a little bit under $10,000 per month of countable income, or about $20,000 if you're talking just earned income. The question that we had in the chat, would withdrawals from ABLE accounts be included in unearned income in premium calculation? I don't believe they actually are, but I would need to do some further check into that, because the ABLE account is money that's already set aside for the individual. So that's technically would have already been earned. So unless you're getting taxed on the ABLE accounts for them, then it's a little bit trickier to understand with that one. So I would say to contact us and we would be able to go through that and try to work through that with you, Nancy. We have a question. What happens if the income changes mid-year? Will the premium be automatically or already adjusted, or are you locked into the one premium for the entire year? Typically, they're only doing the workability assessments once per year, which means if they've applied the premium in say February, if your income changes in July, you'll still be paying that same premium that you were paying in February. There is nothing, however, that would prevent you from going to your county welfare agency and saying, there's been a change of income, whether it's been changed up, whether it's been changed down, that I believe puts me into a different premium structure. Would you be able to do a review of my account? But from all of our experience working with the workability and working with the county welfare agencies, they're only really looking at you once per year, and they're not doing checks every few every few months to see whether an adjustment is warranted for the premium. So then the question becomes with this, how do you apply for the workability? You apply for workability through your county board of social services, and the application is also available online. So the question that we have, one question we have is, and I'll get to questions in just a moment. Just let me get through the last bits of the slides because we're actually almost there, and then I'll go to questions. So how do you apply for workability? You apply through the county boards of social services, and the website that has every county does have a social services department, so you're able to apply through them. And there's also an online application that you can fill out for the age blind and disabled. There is not a separate form that you fill out for workability specifically. It is part of the general ABD application. If you apply for workability, and then you're either terminated or they deny your application, you have the right to appeal that determination. So this would be a proceeding before the Office of Administrative Law. And to initiate an action, you must notify the state agency that you would like to have a fair hearing, and then the action would be referred to the OAL at that time. If you have any questions about the appeals process or about any of the um, application process or the steps for the application, you can always contact Disability Rights New Jersey to discuss your options and to be able to get some advice. Now, with that, I know there are some questions that are already in the chat, so I'm going to pull that up. Mary asks, so there will be no payback if you move up a premium level midway through the year. So if you're saying that I'm trying to understand, Mary. So, like, say if you moved up income levels and you went from a no premium bracket to a bracket that had a premium, would you be required to pay the difference for the months prior to that? Is that what you're asking? Okay. As far as we are aware, no. This is also still, I don't know if the state has quite figured out what they're going to be doing with that because the premiums just got implemented in February of this year. So everybody's in that first year of having that premium structure. As far as we know, at this time, there's no recourse from the state if they were looking to recoup or now charge somebody a premium for the months that have already passed. It would be a premium change going forward. Somebody says, my son is 29 and is working full time. He stopped receiving SSI for 2 years, has SSA Medicaid, received DDD services. We applied on his behalf for NJ workability, were denied. We were told we have to wait for SSA to wipe him out before we can apply. We have reported his salaries monthly to SSA. Is it true that this is a procedure? What can we do to apply for NJ workability? We have also applied in person at the Board of Social Services Board. I would say, Kim, contact us, contact Disability Rights New Jersey, and we'll have one of our staff members speak with you to walk through the process and to find out what's going on with your son and where he is with the services. Because if he stopped receiving SSI for 2 years, if he's still receiving SSI Medicaid, he may not be eligible for workability because he can only be on one Medicaid program at a time. So if he's eligible for SSI or SSA Medicaid, they will not move him to workability because he's already deemed eligible. But I would say definitely give us a call. Somebody says you have 1619B Medicaid through SSI program. SSI must terminate first, and then you can apply for workability. And this is where, yes, this is what I was just saying, where you can only qualify for Medicaid under one program. So if you are under SSI or the 1619B, which is the continuation of services once you've passed the SSI eligibility, you still are on Medicaid. So therefore, the county welfare agency will not look at or move you to another program unless they find that you're no longer eligible for that first program. Peter, we were able to let more people into the meeting. I have more colleagues that have not able to get on. I have not been seeing anybody else that has been popping on because I've been trying to admit people as they've been entering. What is the best way to transition from Medicaid ABD to workability without a lapse in benefits? Mary, the question for that would be, you would need to speak with the Medicaid office, and I would probably say to call our organization and we can help to try to figure out the best way to do that. If you're not eligible for the not eligible for the age blind and disabled Medicaid program and you're looking to switch to workability, we can help you with that application. If you've been found that you no longer qualify for ABD workability, you can file for a fair hearing with the Office of Administrative Law and ask for a continuation of benefits. And while that continuation of benefits is pending, submit a new application and ask to be considered for workability. And so that way it'll be, when they do the application, it'll go back to the date that you were no longer able to get services under the ABD. The workability should be able to pick up and move forward without a lapse in services. Somebody says self-employment. My daughter has MS, is not mobile. If I pay to her to take care of the house management function, answer mail, pay bills, monitor and order prescriptions, make doctor's appointments, arrange house maintenance like lawn and snow removal, will this qualify for self-employment? I will pay her by check monthly. If this is okay, do I have to establish this before applying to workability? They have to already be making wages or to be earning money to count for workability. I would actually say, Joe, to give us a call to talk through that because I just want to make sure that I understand the process of what you're talking about. So you're saying you want to hire your daughter to take care of the household management. I would say let's talk about that privately outside of this webinar. Okay, somebody says I've have so many issues with the local services office. They're not very well work versed in updates. And that's one of the things that we're running into and why we're doing webinars like this, Mary, is we've noticed that the different county welfare agencies aren't always up to date on workability and the different nuances of it. We've had a lot of the county agencies where they come to us and say, well, your individual doesn't qualify for workability. And we're saying, but did you actually like review them for this? Did you actually look at what they were trying to do for this? And they're coming back into us going, oh, well, we didn't know about that. Let's do this evaluation. So if you're having issues with your local Social Security office, give us a call. Somebody said my daughter was removed from SSD because of her salary and Medicare. Can she apply for workability? I was just removed from SSD. Can I apply for workability? Danielle, if you guys are both working, then you're able to apply for workability. If you're saying that your daughter was removed from SSD because of her salary, then that means that she hasn't had a disability determination done by the Social Security Administration. So she should be able to apply for workability with the county to be able to transition into workability. Vivian says, let's say you're married and you have joint account with your spouse. How does that affect the person on workability? Vivian, one of the benefits with this new changes to the workability law, it does not affect the person on workability. They're not going to be looking at the joint bank accounts. They're not going to be looking at the joint assets. What they're going to be looking at is how much that individual themselves makes. So that's one benefit with the changes, that they've removed that spousal income and spousal assets as part of the consideration, and they're just going to be purely looking at your own work records and your own work history and the payments that you receive from your job to be able to determine what your structure is, your premium is going to be. Someone says if the person is working part-time and Medicaid is through social services but was denied SSI, are they eligible for workability? Marjorie, that depends on the reason that they were denied SSI. If they're saying that if SSI said they made too much money to qualify, they would still be eligible for workability. If SSI did a disability evaluation and said that the individual does not have a disabling condition, they would need to wait 12 months to be able to get that assessment from the medical review team from the county welfare agency. At that point, then they would be eligible for workability. So this isn't tied to whether they've been approved for SSI or not approved for SSI services. It's a different bucket for the Medicaid services. Maureen says, my son is on SSI, very minimal amount because he works and is also on SSDI. So I want him to work more hours. So I have to let him work more hours. Then once his SSI terminates because he's over amount, can I then apply for workability? Yes, Maureen, you would be able to apply for workability for him at that point, as long as he is working and earning a wage. And even if he's removed from SSI because he's making too much money, as long as they're not saying that he no longer has a disabling condition, and that's usually through a disability review, then you would be eligible to apply for him for workability. Stephen asks, would withdrawals from ABLE accounts or special needs trust be included in the unearned income and premium calculation? Stephen, I think we had spoken about this a little bit earlier in the presentation, but from my understanding, I don't believe those do count as unearned income. But I would need to do a little bit more research onto the ABLE accounts and the special needs trusts, because for a lot of those trust accounts, the income is already taxed when the person earns it, and then it's put into that special needs trust. I don't know how, and this is just me being flat out honest, because we haven't run into any situations where the withdrawals from an ABLE account or a special needs trust are calculated in that unearned income. So that would be something we would need to either work out or work with a county welfare agency to see if we're able to address it. Once SSI Medicaid ends due to income level, then we apply for New Jersey workability, but will my son lose DDD services during the time of New Jersey workability application process? Typically, Ken, when you receive a notice from Social Security saying that the Medicaid services are going to be end, you have a 3-month period to be able to begin that transition. So once you receive the letter saying that SSI is going to be terminating, I would say at that point, apply for the workability with the county welfare agency, because that will help me reduce any chance of a loss of services. If he's already lost the Medicaid and you're waiting to get him to apply, then if you are within the time, give us a call. We can figure out if you're still within the time where you could file for a fair hearing, because the continuation of benefits would keep the Medicaid services in place while you're going through the application process. We were both removed from SSD because of our salary at work. Okay, Danielle, you should be able to, I'm just going to move to our contact slide, because Joe was asking the contact number for us. You're both removed from SSD because of your salary at work. I would say give us a call. I put our contact information up on the website because I don't want to go over case specific information in this webinar, because it is being recorded and it will be made publicly available. So if you have specific questions about a case, give us a call so we can talk to you one-on-one. Mary says, I have an individual who receives Medicaid ABP. He would definitely pass a disability review. Would I need to apply for ABD first, or can he apply for workability directly? He's never had Social Security benefits. Mary, there is no actual workability application in and of itself. It is all the same application. So if you fill in the ABD application, one of the programs that the county welfare agency is supposed to consider is the workability. So if he's never had Social Security benefits, they would need to set him up with a medical review team to be able to determine whether he meets the standard of having a disability. But you're able to fill out that application for him, right? Like, you can fill out just the regular ABD application. It's all part of that same process. Anne says, my client is calling. Should she leave a message? Will the call be returned? Well, her son says workability was denied and they have no further workability. Okay, I'm going to put also my email address into the chat, so that way if anybody has any questions, they're able to contact me directly. And then that way, like, if you have any questions about the workability, anything like that, you can have them come to me, and or like if they reach out to me, I can get them in touch with the intake, so that way we're able to set up that call, even if it's just like a 1 or 2 time call, to be able to give them advice on how to handle the application. We'd be able to help walk them through that process. And so if they're saying that his workability denied, he has no Medicaid and no DDD benefits, but you believe that he is eligible for services, absolutely contact us. You can reach out to the contact us form that's on here. You can reach out to my email address, and I will make sure that we get somebody in touch and we get the case open, so that way we can get you in touch with one of our staff members to be able to discuss the options and how to move forward. Just a second. I don't think I can actually share the link for the application right now. Just a moment. Let me see if I can. Okay, that should be the application form for the ABD. It is about 26 pages, so just warning, it can be a little bit of a lengthy process. Why would they deny workability to someone who had Medicaid and SSI prior, knowing they need the DED? That's a hard question to answer, Mary, because I think part of it really comes down to which county you're talking about with the welfare agency and who they're whether they're very familiar with the workability process. We're finding that throughout the state, and this is one of the reasons why the employment team at Disability Rights New Jersey is focusing on workability. Not every county is actually handling it properly or really doing the evaluation for it properly. And so sometimes they're not always looking to see that workability. They're just looking purely at the income. They're looking purely at, oh, this person has over $2,500 a month that they're earning per month. So therefore they're denied for services. We're going, wait. Why aren't you doing the workability determination? So it's hard to really sit there and say without knowing anything about that, why the county would be denying the Medicaid services and the workability services. Mary asks, can you have Social Security benefits and workability at the same time? Are you talking workability benefits as in SSI Medicaid and workability? Or are you talking about can you receive SSD payments and workability? If you're talking SSI, no. Because SSI, if you have supplemental security income, that's its own separate bracket for Medicaid services. And so because that amount is like $953 a month, if you're just receiving that SSI benefit, you're or 974.25. Thank you, Sharon. That's under the threshold for ABD Medicaid, but that also has its own separate Medicaid authorization. So you would not need workability if you have somebody who's receiving that SSI benefit. This really comes into play once somebody's no longer eligible for that SSI benefit or they're making too much to receive that SSI benefit. Are there any other questions? Well, for the SSDI, you can actually have SSDI and workability because with the SSDI, you may be making too much with that SSDI, especially if you have an earned income as well. That puts you over the income threshold for any of the ABD variations of workability. So then you would wind up needing to have, that's when you do get the ability to apply for workability. So you can have an SSDI benefit at the same time that you have a workability. And I see we have a hand raised. Elaine, I'm going to ask you to unmute if you would like to, or you can put your question into the chat. It's going to be, Morgan, I'm not sure where the PowerPoint will be available. I know that it will be put up onto our website. I'm going to be sending it to our director of communication as soon as this meeting is over. So it should be up within like the next week or so. I don't know specifically where on our page it is going to be available. Yes, and as Sharon says, when you apply for Medicaid under the age-blind disabled Medicaid, you are applying for ABD, disabled adult child, and workability benefits all at the same time. And then it's up to the local Medicaid office determines which of the Medicaid options you are eligible for based off of various factors. Laura Dicker says, are there still efforts to advocate for the removal of the premiums? I know that there are several agencies that are working on trying to get them to remove the premiums. I don't know where those efforts are. I would need to look into that and then I can get back to you, Laura. So I'm not sure right now if I have the ability to say, yes, people are working to try and remove them. I know people are still trying to say like, hey, this is, especially when they haven't told us how they're counting the unearned income. This is something our organization raised back when it was public comment period in January, that it winds up disproportionately hurting people who may not be able to work and are dependent on those DAC benefits. And so that I know is something that we're trying to reach out to and try to have efforts on, but I'm not sure where they are with the removal. Does WorkAbility have the same rules as SSI regarding bank account balances? No, Ken. With the WorkAbility with the changes, there is no longer an asset limit. So there is no, you have to have under $2,000 in your bank account. You have to have under $5,000 in your bank account. They're not going to be looking at how much do you have saved. They're not going to be looking at how much do you have in your bank account. They're purely looking at how much do you earn on any given year. Well, the recording will be published on our website. Laura, to your question, you just asked, will the recording be sent or will be somewhere? We will be posting a recording of this webinar on our website. In order to apply for WorkAbility, do you need to be registered with an authorized agency who is part of the Ticket to Work program? No, you do not need to be part of the Ticket to Work program to apply for WorkAbility. You just need to go through your county welfare agency. It may still be listed as being part of the Ticket to Work program because it was authorized under the Social Security Administration, but you are not required to work with an authorized agency. Can we submit an online application using this link? Yes, if there is the online application, you can submit it online. Mary says it sounds so easy on paper. This doesn't seem to be the case in many counties. It's been a long process many times when it should be easy. And that unfortunately is correct throughout the state. One of the things that we've been looking into and been trying to help make it a little bit more streamlined, which is why, again, our team has been focusing on helping people with the WorkAbility applications because so many of the counties do not seem to really have the capacity to really process them correctly. So that's why we step in and help a little bit. Can we contact our organization for advice on how to go about next steps for specific needs, seeking advice and guidance on navigating next steps? Yes, absolutely, Susan. You can reach out to our organization and we can give you guys we can speak with you guys. We can work through the application process, tell you how to go about applying for everything. Definitely reach out to us. I've put my email into the chat. You can always email me directly or you can call our intake line, which is the number that is up on our presentation right now. Can nuns apply for Medicaid? They're missionaries of charity and receive a stipend for income. I believe so, Cam, but I would need to do a little bit of research into that. I don't want to say definitively yes or no with that one. So I would say for that one, like you could reach out to us and we could look into it for you, but I'm not sure specifically about the nuns and whether the stipend for income counts as should count, but I cannot say for sure or not. Nancy says it appears that the cost of premium administration determination and the impacts on deterring work efforts of New Jerseyans with disabilities and state revenues from their income exceed any monetary benefit the premium collection. And that's something that I know has been raised with the state as well. And I have a feeling that it's going to be part of the discussions coming to that with the state agency going forward to be able to say like, okay, now you've been collecting these premiums, did you spend more to collect the premiums than you brought in from the premiums? And so they may be having to look at it again next year. But right now, I'm not sure where their efforts are on trying to get that changed. And Elaine, you still have your hand up. I didn't know if you wanted to unmute and ask the question or if you wanted to put it into the chat or if your hand was up from a previous question. Okay, your hand just went down. Are there any further questions? Because otherwise I will end this webinar and we again will be posting this webinar and the slides to our website. So that way everybody has access to it and everybody is able to see the information. You can also visit Disability Rights New Jersey. I've posted our social media websites available. This should be available on both our website and as well our social media pages. So thank you. I do not know if it's going to be today, Laura, but I am going to send it over to everybody. I'm going to send it over to our Director of Communications. How long does the application process take? If you're talking about filling out the application itself, that all depends on the individual. If you're talking about how long it takes you for having the presentation or submitting the application to getting approved, it's very different based off of the counties that you are in. Sometimes we've seen it as quickly as 3 to 4 weeks. Sometimes it's taken 4 to 5 months. So I wish that we had information to really be able to tell you how quickly the application process could take. If you have Medicare and then get Medicaid, are you dually eligible? Are you talking about for the workability program, or are you just talking about in general? Because with the Medicare and the Medicaid, you can be dually eligible and you can get both Medicare and workability through with Medicaid, if that's what you're talking about, Joe. The Ticket to Work program and workability is specifically a Medicaid program. So this is specifically to begin the process of or to get enrolled with the state to be able to get the access to the benefits. The Ticket to Work program is a program through the Social Security Administration where it's working with a network of providers throughout the state to be able to help with job placement. So they're two different functions. The Ticket to Work program is more about job applications and job processing, whereas the workability is being able to get you into Medicaid. Does that help, Karen? Okay. Then I'm going to end the webinar. I thank you everybody for attending, and I hope you have a fabulous weekend. Oh, where to get the workability application? It is the ABD application. So just a second. It is the same application for everybody. Right? Right. Thank you, everybody, and have a great weekend.